Come to Gauteng now, here in Johannesburg, where my colleague Manqoba Mchunu this morning is outside the Charlotte Maxeke Hospital in Johannesburg. Manqoba, a very good morning to you. We're having a health nightmare. Health workers in the Western Cape not getting enough resources. They are stretched to the limit, forced to take sick leave. And you saw in the Eastern Cape earlier with Aviwe Mtila that the capacity issues. I wonder what the situation is like there at the Charlotte Maxeke Hospital.
Well, certainly, Praten, I think the same sentiments being echoed also here in Gauteng. Many of the healthcare workers that we've spoken to, of course, on condition of anonymity, saying that the issues of staffing, the issues around capacity are the major problems that are facing healthcare workers in this particular province. And some of the issues that they've spoken to, of course, are the issues of understaffing at hospitals, which they say is a daily nightmare. Many of them saying that they have to attend to a number of patients every day, and they simply cannot attend to all the patients equally, given such pressures that they face on this job daily. But also the issue of a lack of resources, that has also come up on top as one of the major concerns that's facing healthcare workers. Some saying that they're even forced to even buy their own equipment, they're forced to buy their own working tools in order to try and make the job a little bit easier. But I just want to bring in the DA right now to speak on this. I'm joined now by Jack Bloom, who is the DA's shadow MEC for health here in Gauteng. Jack, thank you for your time. Let's start here. We've talked to several of the nurses, healthcare workers in the province who have really laid bare the harrowing conditions that they're working under. We talk of issues of staffing, we talk of overcrowding, we talk of a lack of resources. What is it that you're seeing on the ground?
Well, this hospital a couple of weeks ago actually had operations cancelled because the air conditioning wasn't working. Now, I mean, something like air conditioning should be properly maintained, and time again you find that equipment fails. I think there's a lack of maintenance. This hospital has had 200 million rand paid for maintenance, yet we still have basic things breaking down. There's leaks in this hospital. We have floods. Air conditioning breaks down. Machinery breaks down. People can't do their work. It's terrible. The backlogs are now very high because of the COVID-19, and yet we have operations cancelled because of air conditioning.
Okay, let's talk about the issue, of course, of corruption, Jack. I think this is one of the issues that the DA has been highlighting a lot, fighting in terms of the health department here in Gauteng. How is that impeding on service delivery at all? Is this a big issue here in Gauteng?
Corruption is always a big issue. The budget is enormous. It's 60 billion rand. It's the same size as the city of Cape Town, and yet we're not spending it effectively. We've seen massive wastage of funds with the PPE contracts. I mean, PPE is absolutely vital. There were substandard masks, and people, I think, have died because they were getting substandard equipment or no equipment at all. So I think we've seen how fundamentally corrupt certain people are in the Gauteng Health Department. I hope that that's all cleared up finally. But there's other forms of corruption, and I think that, frankly, better management is needed. We need the best people for the jobs. We must spend all the money available properly. But meanwhile, we've had something like 2 billion rand spent on PPE very wastefully. So, I mean, the money is there if you spend it properly.
Okay, Jack, another sentiment that you're getting from healthcare workers is that when it comes to COVID-19, many of them saying that they simply believe that they've been let down by government. They feel that they were exposed to this virus due to the fact that they didn't have the necessary equipment, the necessary PPEs that they need to do the job. I mean, what is your sense of that? Are you getting that sense as well as the DA?
I think our health workers were let down. You know, a government failed them. They didn't have enough PPE. And quite frankly, because of all the corruption and mismanagement over the years, we didn't have enough beds. We didn't have enough ICU beds that's why we had to have the alcohol bans, because we can't deal with the normal casualties. So I think health workers have been let down at various stages of the process, and it's time our priority and that patients' priority.
And then just finally, Jack, there are concerns, of course, of a second wave possibly hitting South Africa again. Do you think, looking at all the issues that have been raised by these healthcare workers, the situation, according to your assessment, are we at all ready to deal here in Gauteng with the second wave of COVID-19?
Well, it's going to be a big strain. I mean, I suspect the second wave will not be as severe as the first wave, but we can't take chances. We need to spend our money effectively. We've wasted a huge amount of money on the Nasrec Field Hospital, whereas we could have done so much more if we spent it effectively. We should be spending on hospitals like this hospital. They have put in some extra ICU beds, but why weren't they there before? And, we can't wake up too late. We must be prepared if there is a second wave.
Okay, thank you very much. Jack Bloom, who is the DA's shadow MEC for Health here in Gauteng, saying that there are quite a number of issues in hospitals here in Gauteng, and that really the government will need to come to the party if at all they want to deal with the issues and also to prepare if at all a second wave does hit the province.
Thank you very much, Manqoba Mchunu. There, we're getting views on the ground. As we on eNCA on this Monday, we're focusing on the state of health of our hospital, the state of our hospitals across the country. Of course, we've seen the COVID numbers creeping up yet again, with all kinds of warnings from authorities to us to change our behavior.